everyone, welcome back to the sedation series. I am Charlotte Marquis. I'm a board certified veterinary anesthesiologist, and today I will be talking to you about anesthesia and sedation for critical care and trauma patients. So we here work in a specialty hospital where we have an ER that's open 24/7. So we do see a variety of emergent conditions and wounds that require help in both dogs and cats. So sometimes these patients are relatively stable, but the ones I'm going to talk about today are the ones that are critically ill. Maybe they have like bodily dysfunction disorders, they have active bleeding, they have more invasive or time-consuming diseases. So I want to give you a couple of options for drug protocols, some things you need to think about, and ways that you can prioritize getting things done safely and efficiently. So let's kind of start from the top. So what are some examples of patients that are critically ill that might require sedation or general anesthesia? So think about your animals that have trauma, right? So a hit by car would be a classic one. We see lots of those in the spring when it gets warm again. Gunshot wound, it can happen anywhere, right? Fights, open wounds, very common, especially on the ER service. But also think about things like fluid in body cavities. So that could be blood, that could be a septic abdomen, that could be, urine from a ruptured bladder. It could also be something like chyle or infected material from like an abscess. And also things like airway or breathing emergencies. So certainly any type of like cardiopulmonary disease that requires emergent sedation or anesthesia is a greater risk to both the animal and also for you. So why are these so problematic, or like what are a couple reasons that we might need to be careful with these animals? So usually these animals have more than one problem, which makes not only sedating them difficult, but treating their illnesses difficult to manage at the same time. So common problems, hypoxemia, so a low pulse ox, usually less than 90%. So the problem with hypoxemia is that if the animal does not have enough oxygen being carried in the blood, we can't deliver that to the tissues which need it. So it's things like the brain, the heart, the liver, the kidneys, which suffer first. So this can result in things like brain injury, blindness, kidney and liver injury. But also think about the other tissues that need oxygen. So your wounds, your surgical sites, they need to heal. So we need oxygen delivery for that. So hypoxemia is very important. We need to treat that promptly and respectfully. Pain. So I consider most types of pain an emergency. So especially during trauma, whether it's like a fight, a gunshot wound, a hit by car, these animals have multiple sources of pain, and pain has detrimental effects not only emotionally for the animal, but physically as well, because it's going to increase the heart rate and the blood pressure and quicken the breathing, maybe make it very shallow. So if breathing's not as efficient, sometimes we also have breathing related emergencies. So as you can see, it's kind of all tied together here. Hypovolemia and hypotension. So hypovolemia meaning low volume status, hypotension meaning low blood pressure. So sometimes these animals have been sick for a couple days. Maybe they couldn't get to us in quick enough amount of time. Maybe they have active bleeding, or they have concurrent vomiting and diarrhea. Dehydrated animals will take a little more support prior to being sedated in order so that they do okay. So these are all things we need to watch and try to optimize to the best of our ability before we get started. Hypothermia, organ dysfunction. So sometimes animals get, organ dysfunction like liver, kidney disease as a result of age or, a toxicosis. But also if the animal got hit by a car, just by blunt force trauma, we can induce some changes in organ function and damage. So we need to think about that as well and make sure we're checking things like blood work and doing a complete physical exam. And hypothermia. So if the animal sat outside for a long time in most seasons of the year, or maybe it is in decompensated shock, we need to also provide active heat support in addition to things like fluids, analgesics, sedatives, and appropriate trauma care. So think about, those are all things that you would need to think about and reasons why I see the most problems with critically ill sedated animals. So, what are some things you might need to get ready for this? So, spoiler alert, it's actually a lot of the same things we got ready for laceration repair. So, clippers, scrubs, things for your doctor or surgeon to get that wound, if there is one, closed and covered. But there are some things specific to critically ill dogs that you might also need to consider. So if you are going to be maintaining the patient in the hospital, think about their recovery spot. So think about setting up an ICU kennel for them. This not only includes like their bedding and stuff like that, but also things like drugs, post-op treatments, any type of labels that need to go in the kennel, things people need to know about the patient that are important. So if your patient is having low blood pressure or has active bleeding, we might need to do things like place an IV catheter, place a second IV catheter, or do vascular access in that way. So multiple points of vascular access, so venous catheters, arterial lines, jug caths or PICC lines can be very helpful in these animals for providing more volume, more support, delivering things like blood pressure support drugs should they need it. So second catheters, they're not just for GDVs, they're also for animals that have bleeding emergencies, breathing emergencies. You can think about all of those things. If they need more than one effusion, they could probably benefit from having a second catheter. Other than IV fluids, things like colloids and blood products. So goes without saying, if you have an animal with a bleeding emergency that lost a lot of blood, maybe some packed reds or whole blood. If you have an animal with an albumin or a coagulation disorder, then thinking about something like plasma, albumin transfusion can be super helpful in those scenarios. Think about tagging in someone else. So, if either you or your doctor is struggling to keep the patient stable or you need better advice, think about what type of service would help you. So think about consulting with a criticalist, an internist, neurology, cardiosurgery, anesthesia. Those are going to be things that are available to you at our hospitals, but also you can always reach out to them after the fact by email and say, hey, what could we have done in that scenario? Other things you might want to think about, oxygen supplementation. So especially if you're sedating them, especially if they're critically ill, especially if, the animal is struggling, then giving oxygen is not usually a bad idea. You may also need to think about how you would set that up in recovery. So do you think your animal's going to need an oxygen kennel? Do you think they're going to need nasal prongs? Those would be things to consider in animals that have breathing emergencies. Centesis equipment. So, in critically ill animals, sometimes we have fluid in a body cavity, and sometimes this can impair not only the heart rate and the blood pressure, but also the breathing. So if it's going to be therapeutic for the animal, think about getting out things like a chest tap equipment, maybe some ultrasound for your doctor. That might be a really great way to make the animal more stable before you sedate it. So try to think about those things before you get started, and then you're going to have a much more stable, easy to handle patient. So there's a couple things that I like to think about when I'm trying to prioritize what needs to be done with my critically ill animal. And the way I usually teach this to people is something called prioritize, optimize, perform. So it kind of goes from one scale to the other, so from start to finish. And hopefully this will give you an idea of how to think about these things like I do. So step one is prioritize. So this involves getting a general idea of what's going on and, what needs to be done first. So this involves something called sizing up the scene. So that involves getting a good idea of what is happening to your animal, looking at the physical exam, rechecking if the condition has changed, blood work, history, code status, IV catheter placement. If it's critically ill, we need to have those things covered first so that if there is an emergency, we are absolutely prepared to act. Prioritize. So sometimes, we have a couple procedures to perform and sometimes we have one. But if the animal is critically ill, we need to fix the most life-threatening issue first. So if you need radiographs, but for example, the animal is gasping for air, you need to intubate them first and give them oxygen. Getting radiographs is not nearly as important as keeping the animal alive, right? So if you have multiple things that need to be done, which one will cause the most detriment and which one do you need to fix first? Because if they're stable, they're going to last through the procedure, right? So do that first, do the other stuff later. It's also a good idea to, get a feel for if the animal is so sick that you can't perform everything, what do you want to do first? Like if the animal's not cooperative and they're stressed out and you need blood work and x-rays, do you want the blood work first or the x-rays? So just have that conversation beforehand. 3 is optimize. So this means making sure the animal is as in good condition as possible before you sedate them or anesthetize them. So for an animal that is critically ill or traumatized, this will involve things like maybe fluid boluses, giving pain relief medications, for animals that have arrhythmias, fixing that, getting fluid out of body cavities where it shouldn't be there, things like that. And active heat support, antibiotics, should that patient require it. And lastly, it's perform. So, you've checked your bases, you've optimized their condition, you know the priority of the order of go. Now you just need to get the stuff done. So don't just think about the procedure itself, you also need to think about post-op care. It's important to remember that the vast majority of animals experience complications in the anesthetic recovery period. So it's not usually when we give them drugs or during the maintenance of sedation or anesthesia, it's usually after the fact. And that's for a variety of reasons. It could be hemorrhage, could be hypotension, hypothermia, hypoxemia, or like organ dysfunction. So we need to think about post-op care and treat it just as importantly as perioperative care. Lastly, want to give you a couple of drug combinations that I like to use. Just like other lectures, this is not going to be appropriate or all-encompassing for everything, but certainly a couple options to at least get you started. So if the animal is friendly and cooperative and maybe it's hurting, maybe it had a trauma, giving an opioid IV can go a long way. So especially in friendly old dogs, cooperative adult dogs, this is a super great option to give some hydromorphone or methadone or fentanyl IV or IM, drug depending, and a lot of animals become relaxed. So that's a great option, minimal effects on the cardiovascular system. Other options are things like opioids with a benzodiazepine or opioids injectable local anesthetic and benzodiazepines. So it's important to remember that although benzodiazepines are nice because they're reversible and they provide also relaxation, they're not super reliable sedatives, so some animals actually get excited or aggressive when they get them. But if you have a pediatric, a geriatric, or a critically ill animal, lots of these animals just go to sleep with them. So this might be a really nice option to try if you feel like your animal is not going to be healthy enough for other types of sedatives. And lastly, kind of going along with that, our whole theme of safety here, if you need immobility or you suspect that the airway is compromised or the animal deteriorates during the procedure, whatever that is, convert to general anesthesia. Like give them induction drug, get them intubated, get them on oxygen. So this is one of the reasons why doing things like having an IV catheter and having more drugs can be really helpful. Because in an emergency, you never want to be running around. It would be kind of nice to just have all your stuff there. So those are the things I think about when I think about drug selection and then what I need from that. And that's it.